Hello, my name is Usman Qureshi, and my Teach One assignment will be about precision and predictive medicine. This presentation will consist of two sections: precision medicine, which will cover the Precision Medicine Initiative and NIH's All of Us program, as well as predictive medicine, which will cover the effects of genetic biomarkers and the patient's medical history on predictive medicine. Precision medicine is defined as the prevention and treatment strategies that take individual variability into account. The Precision Medicine Initiative was announced by former President Barack Obama at his State of the Union address on January 20th, 2015. The Precision Medicine Initiative was made possible by some precedents, as blood typing is a form of precision medicine, and by various advancements, such as large-scale biological databases, new methods for characterizing patients, and the ability to perform large-scale data analysis. This initiative's short-term goal was to advance cancer treatment, and it was going to achieve this by analyzing the various cancer genomes, have more clinical trials, and create a cancer knowledge network which would centralize the various studies of cancer genomes. The long-term goal of the initiative was to get a better assessment of disease risk via a better understanding of disease mechanisms. The initiative also wanted to focus on the prediction of optimal therapy for many diseases, as well as expanding precision healthcare into a lot more aspects of the medical field. Next up, this presentation will cover the All of Us research program funded by the NIH, which began national enrollment in 2018 and is expected to last at least 10 years. This program was announced via President Obama's Precision Initiative, which was previously covered, and it was branded as All of Us in October 2016. As previously mentioned, the program officially began accepting volunteers in 2018. They are looking for over 1 million volunteers over the next decade. Some of the goals of this program is to administer a survey of the volunteers, asking them about their lifestyle choices, to gather the electronic health records of the volunteers, to gather various other health-related information, such as blood and urine samples, as well as information from bioinformatic devices such as a smartwatch, and finally to create a database to further advance precision healthcare. Predictive medicine is defined as the utilization of specific laboratory and genetic tests to determine the probability if an individual will develop a disease. First up, a paper regarding genetic markers and predictive medicine will be discussed. The paper is written by Richard Simon, a high-ranking official at the U.S. National Cancer Institute. Simon first talks about biomarkers of disease risk. He reports that there is limited success, as the research has found that the associations are not strong enough to push onto the general population. Next, he talks about how one of the reasons for this in oncology specifically is that there is too much variance of cancer types. And finally, he says that another reason for this lack of success is that some diseases are a result of multiple genetic and environmental factors, which would make it very difficult to find specific biomarkers to show disease risk. Next up, Simon speaks about early detection biomarkers, as an early detection of a disease can lead to a much better prognosis. He reports limited success here as well due to the methodology used by current medical science. He also says that the methodology could be improved, and although he does find it a solution, since I am not a health major, that part of the article sort of flew over my head. He also reports that the findings are not specific for population-wide screening. They're more individual-based. This could also be fixed based off of the methodology improvements he speaks of. Next up, Simon speaks about treatment selection biomarkers, which can be seen as natural defenses provided by the body. It's kind of strange how that works. Some people have these and others don't. Now, this does have precedence and has previously worked. There's a specific test for women with breast cancer that can show whether they have the natural capability to fight it off. However, this is very limited because, as Simon notes, the research outpaces application, meaning that the finds that researchers make often do not reach clinical trials, and as a result cannot be are not utilized for finding cures. The other issue is that, especially in the field of oncology, which Simon is a specialist in, the findings they make can quickly be moot because cancer is constantly rewriting genetic code and mutating. This gap between research and clinical trials is referred to by Simon as the Valley of Death. And this is one of the major problems with using research for predictive medicine, which it needs a lot of. So as first, he provides a list of solutions listed here. The first of which is to bridge the gap from medical problem to research, not vice versa. The second is for natural prioritization of translational opportunities. The third is to measure success based on medical impact, not knowledge gained. And the fourth is to establish mini Manhattan teams to bridge key obstacles. And finally, this presentation will talk about a test done by Dr. Farouk Alemi of George Mason University that talks about how we can identify drug testers based off of their medical history. While I won't go into the math and the specifics of how this test was done, as most of it once again went over my head and wasn't necessarily IT related, I will discuss the goals of this test, which were to construct a set of variables which are theoretically linked to various drugs and some specific drugs, to construct different predictive models to anticipate drug abuse in general and of specific injectable substances, and to report the sensitivity and specificity of predictive models and compare to already published data. And finally, to report how many days sooner than current clinical practice will this approach identify potential abusers. That's the end of my presentation. Thanks for listening.